Our company is self-insured back home, and we have an insurance company that manages the insurance, if you will, for us. And they hooked up with a company in South Carolina called Companion Global Healthcare, which is an insurance broker, I believe, and they have in their organization a group of some 30 hospitals around the world. I started looking into the possibility, and the reason for that is that the medical care outside the United States is much more affordable in places like Health City here. So I started doing my research, and I looked at all of the hospitals they have around the world. I mean, they have them in India and Thailand and Korea and in Brazil, all around the world. And I looked at all of them. The hospitals have all been vetted by the insurance company. The doctors have all been vetted by the insurance company. And so when it came time for me to make a decision, I talked to Companion Global, and they told them I was interested in doing the medical tourism thing, and they told me this was the best hospital and with the best doctors, and that's what I was looking for. I was looking for a place to go that would save our company money ultimately, simply because of the cost of doing the operations here. I had bilateral knee replacements, total knee replacements, yes. I had both of them replaced at the same day, the same time. 3 weeks ago today. If you got to have somebody cut your knees off, this has been an absolutely wonderful experience for us.
Now, what we did was we did a total knee replacement for him, and we went ahead and did a bilateral single-stage knee replacement. Now, what that means is that I operated on him, and because he was quite fit and medically cleared for a bilateral surgery at the same time, we operated on both his knees at the same time. So we operated on both his knees at the same sitting under the same anesthesia, and the very next day after surgery he was up and about. He started walking. He was quite thrilled, and he was surprised as to how little pain he had. By the third or fourth day we were ready to send him back to the resort.
My wife didn't really want me to come down here and do this. She wanted to do it at home because she was uneasy about going to a foreign country, if you will. But I think today, Health City converted her.
I really thought he would be in a wheelchair until we went home, basically, that they would get him up, he would walk a little bit, move around. But he was never in a wheelchair. Immediately they got him up and he was on his walker and then went to crutches, and I was just amazed because the only person I knew in the States that had bilateral knee replacement went to a nursing home from the hospital for rehab and could not take care of themselves, and I thought, oh gosh, how are we going to handle all that? But we didn't have to handle any of that, so it's been great.
You know, it was amazing because before coming down, I was walking there. I was working every day. I was walking, but after I walked the first 20 or 30 feet, my knees started hurting. And the further I walked, the more they hurt. So a walk from here to my room now was virtually impossible without stopping and resting a while. What was amazing to me after the surgery is as soon as I started walking, there was no pain when I walked. I mean, there's some soreness, some healing, you know, from the incision and stuff, but it hurts less when I walk than it does when I sit, or did early. Now, right now, it doesn't hurt at all, other than just the healing process, you know, from the incision is in rebuilding the muscles. It's going to take a while to get that back up, but as far as pain, I don't have pain in my knees now.
But we had a great doctor, but we also had the nurses, the people in the cafeteria. They were awesome. They would come, and if I wanted food, they would fix the food and bring it to me. I didn't even have to wait on it or anything. Everyone was so concerned with our care and our well-being that we couldn't have asked for anything better.
To a large extent, it's not just the surgery. In orthopedic surgery, it's always it's 50% surgery, 50% it's the physiotherapy and the effort that the patient puts in to his rehab. That also makes a big difference to that person's rehab. He is doing extremely well with regard to his rehab, and he's quite pain-free. He's doing stair climbing, and he's quite comfortable with, and he's almost ready to give up the stick. He came into my office with the stick, perched up like he was carrying an umbrella or something. So I told him it's meant to be used for support. So he was doing really good.
One of the most important things, I guess, is that we knew what it was going to cost before we left home. No surprises, no stack of bills that thick. The bill's one page, 4 lines on it, and that's it. Every single person in the hospital we passed in the hall, within a couple of days, they all knew our names. They greeted you by name. One of the ladies that came in and cleaned the rooms, she called me Daddy from day one. It was just a great experience. I mean, I could not ask for anything to have been better.